Not all angels have wings. Some have stethoscope. A very dazzling afternoon to our renowned panel of guests and all the lovely, amazing viewers who are watching us live. And I, Mamta Sharma,
And I, Ayushi Sharma, along with our student Manvi Sharma,
feel honored and privileged to offer an astounding welcome to our eminent and illustrious panel of doctors on the occasion of National Doctors' Day, which is actually observed on 1st July, but we could not have the show on that day due to interrupted internet services in Rajasthan. But never mind, we are here today to celebrate this great day with our great doctors. What say, Ayushi ma'am?
exactly. So it's a day which is celebrated to thank and salute the doctors for their contribution to mankind. It's a day dedicated to these real life superheroes in white.
It is said that medicines cure diseases, but only a doctor can cure patients. And having said that, doctors and healthcare workers are actually the real gems of the society, right?
Absolutely. This day was firstly celebrated in the year 1991 to honor the former Chief Minister of Bengal, Dr. B.C. Roy, to acknowledge his contribution to serving humanity. And St. Edmund School, Malviya Nagar, would like to take this opportunity to celebrate this day and pay a tribute to these real life superheroes. And let me take the opportunity to introduce the first guest for today, Dr. Vikas Gupta. So Dr. Gupta is a DM in neurology and currently working as senior consultant in neurology department at Fortis Hospital. He is also a member of Movement Disorder Society and International Headache Society. Dr. Gupta specializes in headache, stroke, movement disorder and epilepsy. We are truly honored to have you with us, sir.
And it's my
Thank you, ma'am.
ardent pleasure to introduce our next doctor, very renowned and illustrious personality, Dr. Smita Vaid, ma'am. She is Additional Director, Obstetrics and Gynaecology, Fortis Hospital. She is the one who introduced the pro-normal water birthing technique in Rajasthan, and she introduced this naturally and minimal painful method of childbirth. She holds expertise in managing high-risk pregnancies and recurrent pregnancy losses. She has performed advanced laparoscopic procedures for various surgeries and has 17 years of expertise to back her up. She also has presented many research papers in national and international forums. A warm word of welcome to you, ma'am.
Thank you so much. Good afternoon, everyone.
Yeah.
We are really fortunate to have you all with us today. Now, I would like to invite Dr. Vikas Gupta to address the audience who is eagerly waiting to hear you.
Thank you, Manvi. I would like to thank St. Edmunds for inviting me on this talk. I would like to have this to use this opportunity to emphasize more on the preventive aspects. See, when you are ill, then you will come to a doctor. You will go to a doctor. Then then the doctor has to take care of you. But what preventive care? What it helps you in maintaining your overall health. So we have been taught all the time. I mean, from school, in our college, and then even in every talk we talk about preventive health, but nobody cares about it. So the simple thing is you have to just follow something, some good habits in your inculcate some good habits in your lifestyle. Then simple thing, eat balanced diet, take care of your posture, avoid having excess screen time. We see after this lockdown and in the era of online classes, and the screen time of students and even your teachers has gone up. It's more than even 7 to 8 hours. But screen time should not be more than 1 hour or maximum 2 hours for all of for any of us. Then we have to take care of other than diet. We have to exercise well. Then we have to practice mindfulness, uh, exercising half an hour a day for 5 days a week would be enough. But this is what we are failing. We are not doing proper exercise. We are not taking care of our diet. We are not taking care of our posture. then we are we are not sleeping well. See, 6 to 7 hours of sleep is necessary for each and everyone to take care of his or her health. Sleep has got many benefits. It helps in improving memory, improving the immune system. Uh, then taking proper sleep would help us to be very active during the day hours, but we are neglecting that. So we'll be discussing later in our interactions
Conversation.
also. So this is what I would like to highlight.
Yeah, exactly. We have so many questions related to the topics that you just mentioned. So now I would like to welcome Dr. Smita to address the audience who are eagerly waiting for you. Ma'am, you're muted.
Mike.
I feel really glad and privileged to be part of this forum. Thank you, St.Edmund, for being so thoughtful. Actually, a happy doctor is one when the patients get well, better, and quickly, and they return to their homes. So, just a little message to prioritize your health above everything else. As Dr. Vikas just said, that a healthy lifestyle and a balanced diet go a very long way in protecting you from all diseases. And it's not a myth, it's not only in the books, it's not theory. It is practical, it is experience, it is age old wisdom. Do pay attention to your health, prioritize it, take responsibility of your own health. It is not the last thing to do when you return home, it should be the start of the day, beginning of the day, with the thought that I will be mindful of all my activities and will not do anything that may harm myself. We'll
Absolutely.
discuss so many things in the interactive session, but the baseline will remain the same. Take
Very
care of your health. It is so
prevention
precious.
is better than cure.
Yes, prevention.
So, thank you so much, ma'am, for those kind words. Now,
And
actually, what are we waiting for?
now that we know our doctors very well, let's move ahead with the most interesting part of this show.
I hope you're talking about the question answer round.
Absolutely. So we have a lot of questions in store for us for our doctors today, and Manvi is eagerly waiting to ask the questions. Manvi, over to
Over
you.
to you.
Yes, ma'am. Yes. So my first question is to Dr. Vikas sir that as we are spending a lot of time on electronic gadgets, internet, and completely ignoring our posture. So what is the role of posture in neurological disorders?
See, having a good posture while sitting, while doing your studies, while doing office work is very important. And nowadays we use a lot of computer. Uh, so there are few tips to have a good posture and avoid neck pain and backache. So while sitting, the the top top part of the laptop or the screen, uh, it should be at your at the level of your eyes, or at least 2 to 3 inch, 2 inch above the level of your eyes. So that would help you to maintain a neutral posture for your neck. Then while sitting, then you have to don't put your weight above the center of your the center of gravity. You have to sit while slanting at 20 to 25 degrees backwards with a good lumbar support. While you sleep, you just sleep. You don't watch TV, you don't read novels or not don't read any book. So when you sleep, you just sleep. And a small cotton pillow is essential to maintain a neutral position for neck. So don't sleep without pillow and don't use a very thick pillow also. So uh, all of us are in habit of using large pillows and what we
Soft
call
pillow.
massage. So don't use that. So just take care of neck and back.
Okay.
Those tips were really actually very helpful. And while listening to you, I was just correcting my posture, realizing that even I am not sitting in the right posture right now.
Yeah.
So my next question is to Dr. Smita Vaid. PCOS and PCOD are very common these days amongst women. So, what is the reason for this, and what preventive measures and treatment should be taken for the same?
Yes, that's right. In OPDs, we get almost 30% of gynae cases who have PCOS or polycystic ovarian syndrome, and most of them are teenagers, adolescents who are
Right.
just going through a rough phase of delayed periods and acne and unwanted hair growth on their faces and gain in weight. So this the basic cause of this is the same as that of diabetes, which is insulin resistance. Insulin is a hormone which metabolizes substances in our bodies in the
Okay.
right way. It will burn the calories and it will deposit the fat in the right places. It will consume the glucose. When we are inactive for a long period or we are consuming more calories than our body requires, then insulin cannot work efficiently on it. And because of this insulin resistance, the various organs in our body they stop working efficiently. So the work of the ovaries is to make an egg each month and release it, and then a cascade of hormonal changes occurs which leads to a timely period and fertility and good health. So when this cascade stops, ovulation stops, the eggs do not mature in the ovary, they get dumped inside the ovary and give a picture of polycystic ovary on sonography.
Okay.
So when the cycle is disrupted, the estrogen and progesterone hormones which form out after ovulation, they do not form. There is a hormonal imbalance, there is an excess of male hormones or androgens and a less of female hormones or estrogens in the body, and it
Okay.
gives to these symptoms. A period will be delayed, there will be acne and facial hair, and a tendency for rise in blood pressure and blood sugars also, because insulin is required for their metabolization also. So when we know understand the cause of the problem, we right away know the treatment. So the treatment for diabetes is a balanced diet and daily walk. So, as we discussed, a healthy lifestyle and a balanced diet is the basis of all health and all illnesses. So, once we ask the girl to take a balanced diet, we have all been taught a balanced diet right from the first class, but we hardly pay attention to it. It seems like a difficult topic, but then it is so easy to follow when you have the right concepts in your mind. So, less of junk, less of processed food, more of natural things. Simply cooked home food is the best. Though you can always celebrate once in a week, but then that has to be kept to a minimum. Plus, a 45 minutes of daily walk. And as Dr. Vikas said, when you are sleeping, you have to sleep. So when you are walking, you have to walk. No gossiping, no looking at the mobile, and no leisurely walks. A 45 minutes of rigorous walk each day and a balanced diet is sufficient to treat PCOS in the long run. So there are many medicines and hormonal preparations available for short-term relief. But then, a healthy life has to have a strong foundation of balanced diet and healthy lifestyle.
With so many distractions of junk food around, it's difficult for the youngsters, and that's why
No.
they end up eating these things.
Yeah,
And
but see, such diseases, ma'am said such simple cure for it. So if one can follow that, then one can avoid such problematic
You
diseases.
can always liberate yourself to the temptations, but keep that to the minimum. You just compensate it. So you look at the 1 week diet plan, not on day to day basis, but over a week there are 21 main meals. Out of those, at least 17, 18 should be healthy and 3 can be junk. We are not hermits. I am not asking you to just leave everything and go to Himalayas, but at least be wise. Wisdom is the key.
Very true, ma'am. Simple suggestions for avoiding such problematic things. I would like to ask next question to Dr. Vikas. So please tell us that the parents they are skeptical about the vaccination of their kids. How safe are COVID-19 vaccines for children? If you could clear this myth about the vaccines for children.
But see, vaccination. I am of the belief that whatever diseases can be prevented by vaccines, we should get our children vaccinated for those illnesses or those diseases. COVID vaccine is a new thing in our vaccine armamentarium. So and the vaccine has been approved for use in children also recently. So see, the approval comes after rigorous testing. There are many
Right.
trials, so I don't think there is any reason to be afraid of.
Mhm.
The vaccines are safe. You see, any medicine, be it a vaccine, is never devoid of any side effect. There may be some side effects, and
Mhm.
1 in 10 lakh or 1 lakh patient, a person who is vaccinated may have some serious illness also, but that should not keep us from getting vaccinated, and that is true for children also.
Okay.
Doubts of many parents have been cleared about the vaccination of the children. So my next question is to Dr. Vikas, sir. That does any kind of pressure or stress, either study related or job related, result in neuro problems? Doctor, can you help us with some short-term tips for neurological relaxation and support during work?
See, everything comes down to balanced diet and a good routine. So, practicing mindfulness is one thing. By mindfulness, I mean that a person should meditate. He should have a good social circle, hang out with his friends or family whenever he feels stressed out. Then he should exercise at least 30 minutes a day for 5 days a week. This is the minimum which is needed. If you can go for 45 minutes or 1 hour and all days a week, then it would be better. Then having balanced diet. We can have a cheat day in a week. I mean, can have junk food once a week, but for rest of the meals, we have to take balanced diet. There are It's not like that these are some things, these are some food items which are good for brain, and then these are good for immune system, and these are good for skin. By having a balanced diet, we'll cater to the needs of all the systems in the body.
Mhm.
So these are few tips, and just having a good time with family is very important, family and friends.
Very true. Very true. So balanced diet is just not a topic in science books of our students. It's actually something which has to be really, really followed. This
And
is what,
now,
yeah,
and now we know the reason why it's been taught since grade one in
yeah.
schools.
Every chapter, I mean, every science book in
Every
each, there is one balanced diet in all science books.
It's very important.
Yeah. So I would like to ask the next question to Dr. Smita, ma'am. Ma'am, ovarian and uterine fibroids and cysts, these are one of the common problems that females are facing these days. So what is the reason for this, and to what extent the lifestyle play a role in this?
So, we may not be sure of the reason why fibroids are formed in the uterus or why ovarian cysts are formed. Actually, there is a tendency of the uterus to grow so that it can accommodate the pregnancy. But then
Okay.
there are certain points which may grow and produce masses of cells and form a tumor. So they are benign tumors. Fibroids are just benign tumors of the uterus, and every
Okay.
fibroid that is visible on sonography may not
Uh-huh.
need to be treated. The treatment will depend on the size and location of the fibroid and whether it is causing any problem to the patient. And it's the same case with the ovarian cysts as well. Cysts are some fluid filled sacs inside the ovaries
Okay.
which may come and may dissolve on their own. The appearance of cysts also depends on the time of the cycle that the sonography has been done. If it
Hmm.
is more than 5 centimeters in size, or the nature of the cyst is such that if left inside it may cause you any harm, then only the cysts have to be removed. So, every finding on a sonography, because everyone is so vigilant these days, so probably there is an overdiagnosis of fibroids and ovarian cysts but they are not always alarming, and the treatment is not always surgical.
Oh,
Sometimes it's just wait and watch, and if the diagnosis is not causing any symptoms to the patient, then we can just leave it as such. But when they are symptomatic, then fibroids may cause a disturbance in your periods. They may cause heavy, prolonged, and painful periods. And ovarian cysts may silently grow to huge sizes, and then they have to be surgically removed. So it's good to be vigilant, but I think as a preventive health check, just one whole abdomen sonography in a year should be sufficient to take care of all the organs.
So I think all the females out there, you need to be very vigilant about your bodies and keep a track of how your what your body is reacting to certain things, and don't ignore anything that's happening to your body and get
true,
it
Yes,
true.
checked.
it is said listen to your body. So you have
Yeah.
to listen to it. You have to find time and energy for that. So you have to prioritize your health. So you
Yeah.
just don't keep on ignoring your symptoms. अरे देखेंगे यार कल चले जाएंगे संडे को देखेंगे. That is such a wrong attitude.
So
And that's a big problem with females actually.
actually, they actually ignore their bodies, and they concentrate more on
Other
other
things.
things, ignoring their own bodies. And the fact is that you know your body the best, and you are the charge. You should take the charge of it. So my next question is to Dr. Vikas. How common are neurological disorders amongst children and youngsters? And how do they identify these disorders? I mean, how will they contact a doctor without even identifying whether they are suffering from any neurological disorders?
See, as a neurologist, I see a lot of youngsters in my OPD. They come for migraine, and you won't believe now uh, uh, patients as young as 15, 16 years of age, they come with severe backaches. They come
Oh,
with prolapsed discs. So I also wonder what is leading to this. It's sort of endemic. It's very prevalent these days. Backache and neck pain in youngsters. Then epilepsy is very common in young age.
Oh,
It's more common in young and elderly than in the middle ages.
okay.
oh,
Then other problems like uh, mental problems these days. Youngsters are also coming with anxiety and stress related disorders, especially related to uh, examinations. And see, patients of migraine, they have severe headaches during their examinations because of stress, because of need for them to study long hours. They ignore their diet, they ignore their sleep. So at the time of exams, I get a lot of patients, a lot of youngsters, a lot of students with severe headaches. So these are few of the disorders which young people are coming to OPD.
Okay, that's surprising.
very
Uh,
surprising.
and we have so many youngsters in school, so I hope you are listening and paying attention to whatever advices our doctors are giving to you.
So, youngsters, be careful. So, my next question is to Dr. Vikas, sir. Our lifestyle has changed to a great extent over the years. What is the role of lifestyle in causing neurological problems?
See, there are many lifestyle disorders. I mean, the type of life which we are leading these days, the type of diet we are taking, lack of exercise, then a lot of stress. So, lifestyle has it plays a great role in giving us diseases. See, like migraine is a lifestyle disorder, like some cardiac disorders, hypertension, even diabetes is a lifestyle disorder. Then there are many diseases which can be controlled, or at least they can be taken care of by just altering a few things in our lifestyle. So there are many lifestyle disorders which we are facing these days because of poor lifestyle, lack of exercise, lack of sleep, uh, poor diet, then lack of social interaction. people are more people, they have more friends on social media than they really in their real life. So having friends and on social media, that doesn't help much. So you should have a good social circle. Should go out with friends and family a lot. So these are few things we can have in our lifestyle, which will help in preventing some diseases, and at least reducing the effect of the harmful effects of certain diseases and disorders in our life.
So everything revolves around lifestyle and balanced diet ultimately. Every disease, every body part is related to somehow related to balanced diet and lifestyle. So we should
So, ma'am,
actually try to realize the importance of lifestyle, a good lifestyle.
the environment we live in, it plays a great role in modifying our health, in our health, in modifying negatively as well as positively. And by environment, I just don't mean the air we breathe and the atmosphere we live in, but the social, emotional, and other factors are also considered as part of environment when we are talking about disease.
Okay. So, Smita ma'am, nowadays we see so many ads selling these health supplements, protein powders, etc., which are actually targeting the middle-aged women. So, what are the common problems that females face after the age of 40? And how can we consciously fight these issues? And are these ads that we are seeing actually, these products, are they actually very effective and important for us in the middle age?
So around 40, because the ovarian function is going to decline, it will be producing more estrogen. Sometimes the body is not able to adjust to the low levels of estrogen. It takes time. But then it is again reset to the new levels of estrogen. So one thing I want to emphasize is whatever goes in the perimenopausal phase, be it the mood changes or extreme exhaustion or irritability, it is all a transient thing. It has to be over and then a new normal is set. So, but how to face this phase of life is by being really conscious of what we are eating,
I think ma'am's video is,
I think they've lost the
yeah,
connection.
we can't really, I mean, the weather is
Yeah.
such.
I think we should move ahead with the second question, next question,
Next
and then we
question.
can take up the question
Yeah,
again from Smita ma'am.
Smita ma'am. True. So, sir, next question for you. Please tell us about something about cervical spondylitis. Like, it is generally, is it age-related wear and tear affecting spinal discs in neck? But we find it common in most of the youngsters these days. What is the reason for it?
Definitely, cervical spondylosis is it occurs because of degenerative effect on the spine and the soft tissues uh, associated with the spine. The intervertebral discs, the ligaments there,
Mm-hmm.
the muscles, and the nerve. Uh,
Mm-hmm.
so definitely, it's a degenerative, or what you can say, wear and tear disorder, seen more commonly in elderly people, middle-aged people. But because of some lifestyle changes which we are seeing these days, uh, we are seeing a lot of patients of cervical spondylosis and lumbar spondylosis, young patients also. Uh, 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 not not following proper schedule for exercise. Say, these days, people go to the youngsters go to gym. They lift a lot of weights, and they are not doing this in proper supervision of trained trainer. I mean, the trainer is should also be trained. He should be good.
Okay.
Otherwise, they go and simply start lifting the weights. They don't warm up their body, and then
Mm-hmm.
they have these kind of problems. Uh,
Mm-hmm.
I receive one or two patients per week in my OPD. I get to one or two patients which they say that while doing gymming, while they going to gym, they had these problems, and they continue to lift weights, and then they come in very bad shape. So,
Okay.
and then smoking has also got important role in cervical spondylosis in degenerative disorders. It then again poor posture and wrong posture while studying, while sitting, while uh, say while sleeping, while watching TV. So that also leads to the degeneration of spine and the associated soft tissues. So young patients are also coming with these problems these days.
Yeah, the problem actually, I've seen many youngsters doing this mistake that they go to the gym and then they think that the pain is because they are doing the exercise after a long time or they did it for too long. But the reason is different. The reason is that they're not doing it correctly and they ultimately end up having
They're not
disorders.
doing it correctly, and they want to see. I always give an example. I tell them that Akshay Kumar is more fit. He's fitter than Salman Khan. Salman Khan has a better body, but Akshay Kumar is fitter. He's
More fit, right?
more
Absolutely.
fit.
Yes,
So
absolutely.
I think doing cardio exercise, swimming, cycling, treadmill, jogging is better than lifting weights.
True, true.
If you are really health conscious, see if you're just want to show off your body, then that is a different thing.
Yeah.
But he wants that, so let him do that. We'll move on to next question. Answer for you. Next question we have is this COVID virus is that it has affected the immunity to a great extent. Could you please tell us how has it affected actually? Where have our immune system gone?
No, it's not like that. The COVID virus has affected the immunity. Actually,
Hmm.
the virus, the disease is more severe in patients whose immunity is low. Uh, there are many causes. There may be many causes for low immunity. Uh, People with diabetes, they have low immunity. People with chronic illnesses like chronic disease or chronic heart failure or chronic liver failure, they have poor immunity. Then people who smoke and drink, their immunity is low. People who don't exercise, their immunity is low in comparison to other people.
Right.
So, COVID virus itself does not cause reduced immunity or low immunity, but it attacks the people with less, if with poor immune system more than the people with a healthy immune system.
Yeah, and COVID-19 actually helped us realize the importance of a strong immune system in fighting all kind of diseases.
Smita ma'am is back. Welcome back, ma'am.
There was some interruption in the net.
Yeah, so you can continue with the question that you were answering.
So we were just talking about the menopausal problems around 40. So actually, the whole of the body, the functions of all the organ systems are affected. There will be gain in weight, there will be mood changes, there will be weakness of bones, and a strain on the heart because the estrogen hormone protects the heart also. So then a lady is required to take more care of herself regarding her calcium and protein intake, regarding her bone health, which will again require a regular walking, and some basic tests like a breast examination, a sonography, and a pap smear. So for the mood changes and irritability and exhaustion. So the whole of the family has to understand that she's going through a rough phase, which will be a temporary thing, and Achhe Din will surely come back. So regarding the products that are available to help this condition out, actually there are many things which have natural estrogens. Phytoestrogens they are called because they are plant products like soybean extract, flax seeds. They help in fighting out this phase. So include more of these things in your diet. As regards the commercially available products, I don't believe in artificial things much. The more
But
natural you
we have
go,
many preservatives.
less of processed and commercially available over the counter things and more of the natural products, but still there are certain salts or compounds of which we are sure of the composition. Yes, that it works like an estrogen hormone and will definitely help the lady. They can be safely prescribed.
Okay.
That's
So,
really
so fighting menopausal age is a teamwork, and everyone has to just join in to help the lady sail through this.
okay.
Okay, so
So,
next Manvi has
nearing
a question.
40, so be careful.
I am not nearing 40, but
Very
yes.
nicely explained, ma'am.
Yes, carry on,
Yes,
Manvi.
beta.
So my next question is to Dr. Smita, ma'am. That why are girls having early menarche these days?
Yes, this is a frequent observation these days, and as early as in their ninth year of life, the girls are starting to menstruate.
Right.
Yes.
So, yes, it is because again, this excess, which we have all studied about the hypothalamic pituitary ovarian axis. So, there are few glands inside the brain which release hormones to activate the ovaries, and ovaries in turn have a hormonal influence on the uterus to make a period. So, when the brain gets activated because of many chemical reasons, these chemicals are released when there are psychological changes, which may happen because of exposure to too much unwanted media. Before the age that children are exposed to such things, it stimulates their brains and activates the pituitary and hypothalamus to release the hormones which have an effect on the ovary and the uterus. Another thing, the chemicals that we eat in food, the pesticides, the fertilizers, the preservatives, artificial colors, they also have an effect on our ovarian health. So, when the excess gets activated before time, it may also happen in very weak, malnourished children and very obese girls as well. So, it is not like it is a disease of well to do families only. The
Mhm.
extremes of nourishment will also activate, and a girl may develop breast and axillary hair. She will reach puberty earlier than other children. Expected to be because of some disease. We'll investigate for all the causes. If it is because of some disease, we may give her some hormones to block the process so that she reaches puberty at the appropriate time. But if it is only psychological or environmental, then we'll just reassure the girl and ask her to take care of her health and lifestyle so that she grows into a young, healthy female.
Okay. That was actually very informative for all of us because we are actually seeing so many girls. The age has come down from 14 to 15 to 9 to 10 years. So the children, we actually have to explain them in school what is happening, because
So, a
they
sedentary
have,
lifestyle,
yeah,
inactivity, because specifically in these past 2 years when there was the schools were closed because and specifically Edmonds because I have seen the sports that go on all through the day there. Even my daughters were enrolled in Edmonds for a taekwondo class for 3 4 years. So how disciplined and organized the school is and how much you encourage children to be physically active is really commendable.
yeah,
So,
it's
but
very
these
important.
2 years of sitting back at home and just exposed to screen and all sorts of the home delivery, Zomato and Swiggy, has really spoiled our health.
Very true.
Digitalization is not always healthy
Helpful.
So,
and help.
so it is said that science is a good slave, but not a good master. So you don't let digitalization to master you. You have to
True.
be wise here.
Very, very well.
So my next question goes to Dr. Vikas. Dr. Vikas, does age play any role in having neurological problem? I mean, we can see elderly people, their hands and legs trembling sometimes while doing any kind of work. So are there any age specific diseases which specifically happen in the age when you are old? And what are the
Yeah, there are
reasons?
many disorders which are seen in particular age groups. Like what you were telling was probably Parkinsonism. The patient has tremors, has difficulty in walking, has stoop posture. So, Parkinsonism, like dementia, disease where uh, patient has memory disturbance, he has behavioral problems. They occur in 6 or 7 decades of life. Then stroke, which paralysis, paralytic attack. So that is also seen more commonly in elderly people. Then balance disorders, they are seen more commonly in elderly people. Then some disorders like epilepsy, they are common in young ones, the infants and children, and they are common in elderly population. The middle age population is no, they also have epilepsy, but the prevalence is very less. Then the degenerative disorders of brain or of spine, they are more common in elderly population. Uh, the genetic disorders, they are more commonly seen in younger age groups. So age definitely has got a role to play uh, in the manifestation of disorders, diseases.
Okay.
Thank you, sir, for the information. Now, my next question is to you only. That is there any way we can activate or trigger our neurons for performing better?
Yeah, there are many ways. We have been talking about them for the last 40 minutes. Having a healthy lifestyle is one of them. Then, uh, see, good diet, balanced diet, then exercising regularly, then practicing meditation, uh, enjoying life actually would definitely help. And there are some games which help in improving memory, like Sudoku, playing chess, and even see what we used to play business, or
Yes,
Playing
sir.
it is called something else these days. So these are games, board games. They help in activating the neurons and help in improving the memory, and definitely not only memory but overall mental health.
So the children should understand that there are no shortcuts for having a good health. You have to work on your body and your lifestyle.
So these are shortcuts.
But
See,
how
see,
are
we are
these?
not asking anybody to do any Herculean task. We are not asking to them to lift the earth. It's just following a good routine that will do all the good for their health.
Generally, everyone follows shortcuts, but these shortcuts are such that no one wants to follow.
And which are actually the most important for
Yeah.
them.
See, these days we are talking of primordial prevention. See,
Okay.
uh, primordial means that when the disease is not even is thinkable in a particular age group. So it would be better to go for preventive health rather than treatment, and then prevention is always better than cure.
Mhm. So one more thing I wanted to ask regarding these neurological issues, how much physiotherapy is helpful?
Physiotherapy is definitely helpful in most of the neurological disorders. See,
Okay.
in patients with paralysis or patients of stroke, what physiotherapy does is it keeps the limb in proper in the elasticity, and uh, mm, the elasticity of muscle is maintained. Then by physiotherapy, we are programming the brain to reactivate. See, when a stroke happens, the area which controls a particular part is dead, and it is dead means that it would not recover again. So, what we are doing with physiotherapy, we are trying to reprogram the brain, the rest of the brain which is available for use, to do the task of the dead brain also. So, we are using this is called plasticity, neuroplasticity.
Hmm.
Then, in disorders like cervical and lumbar spondylosis, physiotherapy helps to strengthen the paraspinal muscles, and that would lead to good spine health and would help in relieving the pain. So, physiotherapy is very much helpful.
Okay.
That's really
Yeah,
Good
we
to
should
hear.
go
We
to
should.
a good physiotherapist for that. Not try it at our homes, trying to become the physiologist themselves and doing it.
We do it at home, yeah.
So today, many of our viewers and audience they obviously could not join due to internet connectivity issues. Uh, you all can, so the audience, you all can watch the recorded version of it on the Facebook page itself. You can see the recorded thing, and if not, if you could not attend it live, and we do have Dipen sir, our academic head and principal ma'am, welcoming both our guests for the on our show and gracing the occasion. You can read the comments later on in the Facebook page.
So I think
Now that we are running out of time, I
it's
think
all
we
45
should,
minutes.
conclude the session. I think Smita ma'am is trying to say something.
So it was just a, I was expressing my delight for being with all of you today. So
Ma'am,
I'm
it was a
thankful to
pleasure for
you.
all of us to have
Yes,
such
ma'am.
renowned doctors of Jaipur on our
On
show,
our show and gracing the
and
occasion
and for that insightful, session.
session.
Thank you so much.
Thank you, ma'am.
Thank you. Thank you so much.
Manvi?
I take this opportunity to thank Dr. Vikas Gupta and Dr. Smita ma'am for gracing this session and for taking out your precious time for this. It was really a worth listening session. I hope audience too have enjoyed it. So doctors are one of the most inspiring figures of society and their efforts should be celebrated every day. Happy belated Doctors Day today.
Thank you so much.
Thank you.
And once again, thanks to both the doctors for being here and
Sparing their
sparing
time
the
and
time
gracing the
on Sunday.
occasion and on Sunday and enlightening us so much.
Thank you.
Thank you so
Thank
much.
you, audience, for watching us. And with that, we would like to just
Conclude the
conclude the
session.
session.
So it's a thank you from all of us from St. Edmund's Malviya Nagar.
From the entire Edmunds family, we would like to thank you. And we are now concluding the session.
Thank you.
Thank you.